Okay? Right. Come closer. You need to see it from close distance. I think 3 on the table is quite a lot. All right. Thank you. So I will demonstrate and explain while I'm doing it, okay? So I'm going to teach you not only the technique itself, but how to incorporate it into the flow of the massage. It's one example of it. It's not going to be always the same. Just to give you some kind of an idea, where would you put deep tissue into your treatment? So you start, again, you can do a nice hold. Don't forget the basic. For you, you might do hold for many, many times. But for this client, it might be the first time that they ever had massage, or the first time they had massage with you. You need to start from a clear page with every time and every client. So don't let yourself believe because you're in the middle of the course you can rush the hold and just go through it because you've done it before, you know it. No. Really, the basics are very important. And just empty yourself and see what comes to your mind, what feels different, how much give there is, how their breath is, the rhythm, the depth. I feel that clients start breathing different, and I encourage it. It's more being an observer here rather than do something. Listening to the body, listening to how it moves, listening to the tissue, listening to the texture. This wonderful move, it's like a dinghy. I feel that my hands are like a small boat on the sea. It's kind of floating there on the breath. Okay, I'm ready to move on. Coming and pushing it. Tape. Taking a little bit of oil. And then, although they attempt to move right away into quick effleurage, always start really slow. Even if you want to do a stimulating technique after, give them the space to just be. Don't treat them right away, just let them be. Even if the oil is missing now, I continue a little bit. I don't want to break this moment. And move away from kind of the tactics of just doing one direction. So if you want, really move your body and let your hands like brushes to just follow what you're doing. Doesn't have to be long, doesn't have to take long time. I start with petrissage a little bit. So I feel that it's ready. You don't have to take the 5 minutes to effleurage routinely. Yeah? All right. I go a little bit deeper. And you see that actually it's the whole body experience, your body experience, yeah? How you're moving. Observe that I'm kind of leaning in. If I will stop now, you see that my eyes are above the spine. Okay, let's continue with some knuckles petrissage. Slowing down. Sensing and treating, always together. You're not only doing things, but you're also listening to whatever you do. Now, I feel with this client, and you can observe it, you can see that the muscles are quite nicely toned, and you may talk on the consultation that this client likes deep tissue, they've had it before, and they're enjoying it. They feel a relief from muscle tension. They feel a relief from an ache if they have. And you feel that the muscle tone do require deeper work. You can do it with compression. However, it will take a long time, isn't it? It will take quite a long time. It's big muscles. So you need to find something that would work like, think about it. Oh, do you know this machine that put the asphalt, sorry to break it, do you know this machine that puts the asphalt on the road? How slowly they put it and kind of ironing it into. So you want something really kind of deep and nice to reduce the tension in the muscles there. So you can start with deep tissue. However, the first time you want to just warn the client that you're going to apply deep tissue, and you may agree before, as we talked with Katya about finding a scale to say, let me know if it's worse than 7 out of 10, yeah, when it's comfortable. So I'm going to apply deep tissue. Let me know how is the pressure. Sure. If it's too much, let me know. I'll ask you once in a while. Okay, so I let them know first time. If they fall asleep or something, that they are not going to jump from that, okay? And then you kind of arrange yourself. You see that the hand, the arm, can be on my way. I need to bring myself closer. I might need to move it a little bit, so then I can come and apply the pressure in a comfortable way. All these adjustments are equally important. It's not only the technique, but how do you set it up to start with? So you're preparing you're finding a reasonable place that would take for you time to find, and then you're putting your hands, you're putting your forearms. Now there are a few ways you can put your forearms. You can put this part, you can you feel your forearms together? Yeah? So there are the extensor muscles and the flexors, and in between, do you feel that? Which bone is it? Remember the radio of the antenna? Yes, radius. So this is the ulna. Thank you. Yes, good. Okay, so this is the ulna bone. Yeah. Can you feel how it goes all the way to the elbow? Yeah. So if you want to do something a bit deeper with more pressure, you can put your ulna and massage. If you want something a bit less, you can just rotate and work with the muscle to muscle. It's going to be less intense. Yeah? So now I would like to start with muscle to muscle, so I will have to put the palm facing me. Yeah? Now, I'm arranging myself, and I putting the other hand here just to support it. And I'm be sure that the palm is quite relaxed. I don't put any pressure, and I really want you to work for now with this pace. Don't start right away. Really arrange yourself before. Now, I need to feel that I'm on the erector spinae, right? You may want to palpate it with your hands, and then put your forearm in the right point. So it's not going to be on the spine, and it's not going to be off the muscle. It has to be on the muscle of the spine. Then, remember the submarine? I slowly sink. I don't move yet. Don't start moving. I put it, arrange myself, and then I bring my body and slowly sink into here. I feel now it's better for me to work with a forearm this way, so I may turn the elbow. There is a bit of control here. And I slowly sink in. How's the pressure?
Okay.
Can I go deeper?
Yeah.
Is it deep enough? It seems like not. Okay. No. How is it now? Can I go deeper?
Yes.
Okay. How is it now?
Okay.
Someone jump on his back.
Yeah, all right. Okay. So what have I done? I ask, how's the pressure? Okay. Can I go deeper? Yes. And I check to see if it's actually better. So don't leave it in between, because the tendency is, how's the pressure? Okay. Did you hear what he actually said? He said okay, but was it okay?
No.
So don't believe what people are telling you. Really hear what's actually underneath there. He wanted more pressure. I was at the end, was not able to apply it for now. And it's good because you will not be able to apply it as well. I don't want you to stress yourself. I want you to learn slowly by slow. So it's a great example of how I can do better and better, but sometimes I would say, okay, my health is also important. I can't apply so much pressure for now, okay? Good. I would like you to practice that without moving. And then after that, do the same. So again, preparation, see the hand is good, preparation. And then slowly after that, I will ask you to start applying some movement. But actually, where does the movement come from? From your legs. So it's very slow movement, and I want you to have this image of this machine that lies the asphalt. It's heavy, it's slow. If you do it quickly, what would happen?
Muscle can glide.
Muscle can glide. Worse than that.
Tense up.
They can tense up and you can hurt them. The deeper you are, the slower you have to go. If you go quickly, you can cause pain. Yeah? So if you build a depth relationship, you have to take also more responsibility. You can't just go quickly because it's going to be painful. Yeah? So, again. Do you see that it's moving? Does it move a lot? No? So, yeah, that's kind of the speed that is good enough. You don't need to do a lot. Then once in a while, you may want to change your position. Okay? I would ask you to do it only on this area, because here you have the scapula and it might be a bit difficult. We'll talk after that and how to do it, okay? I don't want to talk too much. Should we give it a try? Yeah? About, say, 10